I just finished calculating a diet for a patient with advanced brain cancer. Unfortunately, his previous cancer treatments have not been effective. Several studies have demonstrated that these patients might benefit from ketosis. A person can enter in ketosis with different diets. They may follow, for example, a Mediterranean-based diet, but this patient in particular was a vegetarian. First of all, what's ketosis? It's a metabolic state defined by an increase in ketone levels in the blood. Beta-hydroxybutyrate, one of the ketones, must be above 0.5 millimole per liter. Depending on the disease, however, ketone levels have to go higher, so the patient might benefit from it. There are several methods to induce nutritional ketosis, such as exercise, fasting, the ketogenic diet, or the use of supplements, such as MCT, that can come in powder or in the liquid form. MCTs are rapidly converted in ketone bodies, and the patient may also benefit using exogenous ketones that increase ketone levels in the blood almost immediately. Ketone bodies have been shown to influence a variety of cellular processes such as gene transcription, glucose and lipid profile, mitochondrial function, oxidative stress, inflammation, blood pressure, and body weight. Circulating body ketones at any moment in a healthy person normally range from 0.1 to 0.25. Prolonged exercise and fasting can increase those levels above 0.6 to 1 millimole per liter. But patients with certain cancers or even neurological disorders, mental disorders, such as bipolar disorder, benefit from higher levels of ketones, frequently between 2 and 4 millimole per liter. Ideally, ketone levels should be measured 2 to 3 hours after a meal, twice a day if possible. Patients can use, for example, ketone strips. Many people do not find it easy to achieve nutritional ketosis, especially in such higher levels without restricting carbohydrates in the diet for about 20 grams per day. It's a very low-carb diet. Remember that the standard American diet often provides between 200 grams and 300 grams of carbs a day. Studies have been shown that the ketogenic diet in combination with standard treatments for cancer enhance their anti-tumor effects safely and with good tolerability. It especially improves the quality of life of patients with breast cancer or glioblastoma. But for vegetarians, it can be a challenge to reduce carbs so much without relying on supplements such as MCTs, exogenous ketones, or even carnitine. MCT oil and powder supplements usually contain a combination of C8 and C10 triglycerides. In contrast, long-chain triglycerides, which are very common in the Western diet, contain more than 12 carbons. As MCTs are smaller, they are easily absorbed and easily converted into ketone bodies. Long-chain triglycerides, for example, contained in soy oil, are highly dependent of digestive enzymes. After absorption, they need to be esterified to enter the mitochondria, requiring carnitine. We can easily find carnitine in meat, but as vegetarians don't consume animal products, they highly benefit from carnitine supplements. Studies indicate that many cancer cells cannot use ketone bodies for energy. Therefore, a low-carb diet and good supplements will benefit the patient, as ketones inhibit the proliferation of tumor cells. Of course, you can learn much more in Big Keto's website.